Hello, everyone. Hope you are staying well. We are asking questions to get answers as this pandemic continues to evolve. Our health analyst is Dr. Payal Patel Davladabadi. She's an associate professor of public health at the University of Evansville. Dr. Payal, the CDC is now saying those antibody tests may not be as reliable as first thought, indicating almost half may be flawed. What's your reaction, and should you get retested?
Right, these antibody tests are in abundance. Actually, they were approved via emergency use, so really haven't been tested for accuracy. There are over 100 antibody tests, and so there are only very few that may be accurate, but as of now, we need that reliable and accurate test to show if antibodies are present. There's still a lot of false negatives, and so we can't really rely on that at the moment when trying to determine when to reopen certain businesses and universities and schools at this point in time.
You know, the virus is affecting so many different age groups. Children with autism, has the pandemic caused a major issue with these kids?
Yes, it really has. Just with children in general, it has caused an issue, but specifically with kids who have autism, they're really out of their routine and kind of consistency that they typically see at school, and this may create some type of anxiety. So it's really, there are a lot of resources on the CDC's website that help parents to establish that routine and keep it consistent at home just to minimize that anxiety.
Indiana Health Commissioner Dr. Christina Box says many Hoosiers may not realize that this is not going to be a normal summer. She cites photos she has seen of mass gatherings on Memorial Day weekend. What do you think?
It's unfortunate. We are seeing mass gatherings, people not social distancing, not protecting themselves by wearing a mask or a cloth face covering. It's really the most important way we can help prevent the spread of virus. If we don't do that, we're going to see another spike and another resurgence. And aside from that, it will be a different summer. It will not be a normal summer. Even farmers markets, if they decide to reopen, they will have to follow those social distancing guidelines. So yes, it definitely will be a different summer, but just because restrictions are being lifted, it doesn't mean we can just, venture out without protecting ourselves.
Well, Dr. Payal, let's say if you test negative, is it highly possible you may have to get retested, depending on the circumstances, of course? And the reason I'm asking this, I think some people have possibly a false sense of security simply because they have tested negative.
It's very true. False negatives are actually really common, and it really depends on when you're getting tested. If it's earlier on in the infection, you may not have enough virus in you for that nasal swab test to detect it. So you need to give it enough time for the virus to replicate. And oftentimes, someone may test negative one day, and then given that 24 hours for the virus to replicate, they may test positive the next day. So just because you test negative, it may be earlier on in the infection. It's important to get retested, especially if you know you've been in contact with someone who's had COVID.
And how are nursing homes going to cope with this virus, Dr. Payal, if they don't have enough PPE for their workers?
Nursing homes across the country have shortages of PPE. There's some mismanagement issues there as well. Workers are getting infected. We've seen so many stories of outbreaks, but just today, FEMA did issue much needed PPE to nursing homes across the country. So hopefully this will help and prevent spread even further in nursing homes.
I want to ask a hypothetical here, Dr. Payal, but this is happening in a lot of places. Say like if you walk into a store or a restaurant and workers do not have masks on, should you just turn around and leave?
Right, and my response to that is if it's something you need that's essential, perhaps groceries or whatever it may be, as long as you're keeping that distance of 6 feet or more and you are protecting yourself with a mask, it should be fine. But if it's some type of leisurely activity, then it's really not necessary to risk it.
All right, Dr. Payal Patel Davladabadi, as always, thank you so much for taking your time, and stay healthy.